Namaste and welcome. I'm Julie Hill. I help people improve their movement, eliminate pain, and get back into doing the activities they love. Today, I wanted to share with you a breathing practice that you can do to gain more stability in your body and your life. Lots of people talk about the fact that they're starting to feel a little unbalanced, or perhaps they have a hip pain or shoulder pain going on. And really, the first place that we need to check out is that this inner line of stability, our deep inner core, is really active, and that we're able to maintain inner abdominal pressure. So it's a little bit different than the superficial core or crunches kind of exercise, and really coming deep down inside, a little harder to feel. It's a little more subtle, and sometimes it's harder for people to connect to and train. And so we'll just start out with this easy breathing practice and kind of grow from there. And so I'm going to ask that you have a chair available. If you need to pause and go get that, great. We'll come down on the floor on our backs. You might have to put something under your head if you're uncomfortable on your back, but if you're okay without it, please go there. And we're going to work on setting our spine up properly on the floor. So we'll start up just by bringing our feet up onto the chair. We want to come into what's known as a supine 90-90 position. So we're on our back, supine. We're bringing our hips into 90-degree of flexion, so the knees will be directly over the hips, and then our knees are in a 90-degree of flexion, and heels are just resting on the chair. And then from there, it's really about how we are laying our spine on the floor. We want to bring it into its natural curves. So we'll have a little lordosis in the lower back and in the back of the neck, and we'll have a little kyphosis coming through that thoracic area of your spine, right? So we're going to be training this natural position in our spine as we're working on building this stability, this inner abdominal pressure. So you can check out by making sure that your hips are level or they're in a natural position. And you can do that two ways. One, you can feel for the bony landmark in the front of your hip, which is called ASIS, and you can feel for kind of where that same thing is in the back and making sure that they're level, so they're not tipped one way, they're not tipped the other, that we find this neutral place. That will also bring a little bit of lordosis curve into your back. So it's not going to lift it too far off the mat. That would be too much curve, right? And you can tell that my hips aren't even, they're not level. It should just be a light lifting of your lower back. It's also not pushing that lumbar spine into the floor. That again would tell me that my pelvis isn't really neutral. So bringing it back to what's neutral. So you can just slip a few, maybe fingers lightly under, not all the way through, but a little bit back there. And then coming up your spine a little further, we want the ribs to be relaxed and down. So they're not lifted, right? That's, again, causing that curvature to change in the spine. So we want that to relax down. And for some of us, it'll be a conscious bringing the ribs down. And then if you're anything like me, it's your shoulders that would want to kind of roll up. So letting them open. The collarbone stays open here. The back of your neck will be long. So if your chin is kind of pointing up, you'll have to lengthen the back of your neck consciously, shifting a little more lower kind of connection with your skull on the floor, and that the chin would kind of drop down towards the floor. Teeth are going to be separated here, so jaws relaxed, lips are sealed, breath will happen through the nose. You can find a spot to look at. And we'll start here by just maintaining these cues and noticing how this feels in our body. And maybe your shoulders want to creep up and you'll consciously have to let them relax and stay open here, or maybe your ribs will want to lift and you'll consciously have to bring that back. And then allowing yourself to come into a breath that's a 1-to-2 ratio. So for you, that might mean you breathe in for 1 count and you breathe out for 2, right? The exhale is twice as long as the inhale. You might have a longer breath in. So you might have a 3-count breath in, and then it would be a 6-count breath out. Just find the inhale that feels comfortable for you and work to start to bring the exhale to be nearly twice as long as the inhale, maintaining all of the cues that I just walked you through. Make sure that when you exhale into this longer exhale through your nose, that you're not holding with your jaw or getting tense in your neck. It's really being controlled by your abdominal muscles, right? We're working that inner abdominal pressure to start to maintain and build in our body so that it can support us when we move our arms and our legs. After you've done a few rounds of that and you're feeling comfortable, we can start to add a little more load into the body. And so I can start by flexing my feet. Right? As I flex my feet, I activate the back line of my legs. I could push my heels down into the chair seat a little bit, adding a little more load there. And we can bring the arms into it. I'm going to focus on my pinky and my ring finger coming to the sides of my legs. And I'm going to make sure that I'm not stretching my arms straight. I'm actually kind of coming into this place of where I might be like hugging someone. That's the kind of rounded, nice circular position with the arms that we're looking for. I'm going to push my legs out into my pinky and ring finger and let those fingers press back into my legs. So there's a little energetic exchange there, and I'm going to continue with this breathing. Really double checking that you're not getting tense with your jaw, right? Teeth are still separated, tongue's on the roof of the mouth, lips are sealed, there's no tension in your neck, right? And just kind of building. Maybe you stay here and this is where you practice. Take a few rounds, take a break, come back to just your normal breathing, and then come back for a second set. If you're feeling really good with this and this is going pretty easy for you, maintaining all of your cues, hips neutral, ribs down, collarbone open, right, neck long, chin drawn back, and then finding that jaw relaxed, lips sealed, tongue on the roof of the mouth, you can start to add a little more. So maybe for you at the top of an inhale, you start to lift the heel off of the chair. And then find that twice as long exhale. Again, coming from your abdominal area, not from your neck or your jaw. You can stay there for a few times and then release it. We want all of this to stay as those cues talk about, rather than when you lift the leg, having your pelvis move or having your ribs lift or shoulders roll in, right? All of that would stay. If you're feeling pretty good with that, allow yourself a few rounds. Maybe you do that and then take a break and come back. But if you're feeling okay with that, we'll take it a little further. So you take a breath in, and then after you've breathed in, you lift a leg, maybe a full round of breath. After the second inhale, you lift the other leg. Feet are still flexed, legs pushing into fingers, fingers pressing back into legs, and then maintaining this hip position. So you'll notice when I lifted my legs, I didn't let the hips rock in order to lift the legs. And I've gone a little past what I can maintain. So we want to build this pressure so that it really teaches us to support the spine in this kind of natural curve position while we're building this inner abdominal pressure. And you'll find that within a short period of time, after doing a few reps, maybe every day, it doesn't take but a few minutes. If you do it in the morning or in the afternoon, we always want quality over quantity, right? So making sure all the cues are in place, that we're really training ourselves well here. And then you might just find that you don't need the chair anymore, that you can just come from a position on the floor here, right? Cues in place, and you're able to lift a leg and the other without rocking in your pelvis, without lifting up your rib cage, or rolling in on your shoulders or head, kind of lifting one way or the other. And then working from there. And just kind of think of it as an exercise like you're lifting weights, right? We do a set. Maybe for you it's 6 to 8 breaths, and then you take a break, and then you come back again. Amazing the difference of stability that you'll start to feel in your body, so that it's easier to move your arms and legs around, that you don't have to brace with the shoulder or your jaw or in your hip. when you move. If you have any questions, please reach out to me. I'm happy to share more information or perhaps work with you, whether it's in person or via Zoom. You can reach me at julie@yogabodylllc.com. Here's to a happier and healthier you. Namaste.